Good evening, guys. I've got discussion A for you tonight. We're discussing long-term care costs can be a huge problem for seniors. So here we go. This is why. I'm going to explain it to you now. Okay, here we go. Long-term care costs can be a huge problem. Experts say here's why. Explores the financial burden of long-term care in the U.S., emphasizing how unprepared most households are for these expenses. Key reasons long-term care costs are problematic. Okay, number one, high out-of-pocket expenses. About 1 in 7 Americans will spend at least $100,000 on long-term care. The average projected costs for someone turning 65 today is around $122,400, but many will need care for years, pushing costs much higher. Limited insurance coverage. Health insurance and Medicare generally do not cover long-term care services. Medicaid only applies to those who meet strict income assets requirements. Few Americans have long-term care insurance due to high premiums and limited awareness. Widespread need. According to a 2022 report by the U.S. Department of Health and Human Services and the Urban Institute, 57% of Americans who turn 65 will develop a disability requiring long-term care. Conditions include dementia, Alzheimer's, Parkinson's, and stroke related complications. Lack of planning. Financial planner Carolyn McCanahan notes that many people don't plan ahead for these costs, making the financial impact more severe when care is needed. Implications for policy and practice. This issue intersects with broader concerns about aging equality and systematic healthcare reform, areas you're deeply engaged in. The data underscores the urgency of expanding access to affordable long-term care insurance. Designing culturally responsive planning tools for diverse communities, advocating for policy shifts that integrate long-term care into broader health coverage frameworks. Would you like to explore participatory models or toolkits, ideas to help communities better prepare for long-term care needs. To prepare for long-term care costs, individuals can take several proactive steps to reduce financial strain and increase access to needed services based on the article and broader best practices. Here is a structured approach. Okay, individual strategies for long-term care planning. Number one, understand your risk and needs. Access family history and personal health risks, dementia, stroke, things of that nature. Consider the likelihood of needing care based on age and lifestyle. Explore insurance options. Long-term care insurance, purchase early to lock lower premiums in. Okay, look for hybrid policies that combine life insurance with long-term care benefits. Medicaid planning, consult with an elder law attorneys to understand eligibility and asset protection strategies. Build a dedicated savings plan. Set aside funds, especially for long-term care in HSAs or RAs or other tax advantage accounts. Use financial planning tools to estimate future care costs and adjust savings goals accordingly. Leverage community and family resources. Discuss care preferences with family to plan for informal caregiving or shared housing. Explore local programs offering subsidized home care, adult day services, or caregiver support. Create a legal and care framework. Draft advance directives, power of attorney, and care plans. Include culturally responsive preferences and values in care planning documents. Monitor policy changes that affect Medicare, Medicaid, and long-term care funding. Engage with community organizations or advocacy groups to stay ahead of evolving care models. Would you like help designing a culturally tailored long-term care planning toolkit or a community workshop framework to support these strategies? Based on the article and surrounding content, here are several types of community resources that individuals and families can tap into for long-term care support. Community resources for long-term care support. Give me 1 second, guys. Okay, folks, here is the first one is Area Agencies on Aging, or AAAs. Offer free, low-cost services like care coordination, home-covered meals, transportation, and caregiver support. Often serve as a hub for connecting with Medicaid waiver programs or local nonprofits. State Medicaid waivers programs provide home and community-based services. Okay, HCBS for eligible individuals to avoid institutional care. Services may include personal care, aids, adult day health programs, and respite care. Local nonprofits and faith-based organizations. Many offer culturally tailored support groups, volunteer caregiving, and dementia-friendly programs. Examples include Alzheimer's Association chapters, Meals on Wheels, and interfaith coalitions. 4. Community health centers and aging clinics provide geriatric assessments, chronic disease management, and referrals to long-term care services. Some offer sliding scale fees or bilingual staff to support diverse populations. Caregiver support networks, peer-led groups, online forums, and training workshops help caregivers manage stress and access resources. Some are hosted by libraries, senior centers, or universities. 6. Digital platforms and toolkits. Online portals like benefitscheckup.org or Elder Care Locator help identify local services and financial aid. Some communities are piloting participatory digital tools to co-design care plans and resource maps. Eligibility criteria for Medicaid waiver programs, which provide home and community-based services to help individuals avoid institutional care, can vary by state, but generally include the following. Core requirements. Common eligibility criteria. Medical need. Most require a level of care typically provided in nursing home or institutional setting, often assessed through a functional needs evaluation, e.g., ability to perform activities of daily living like bathing, dressing, eating, and then you've got income and asset limits. Must meet Medicaid's financial eligibility thresholds, which vary by state. Some states allow higher income limits for waiver programs than standard Medicaid. Asset limits typically exclude primary residence and personal belongings, but savings and investments are counted. Okay. Age or disability status. Many waivers target specific populations. Seniors, usually 65 plus, individuals with physical or developmental disabilities, people with cognitive impairments like dementia, residency and citizenship. Give me 1 second. Must be a resident of the state offering the waiver. Must be a U.S. citizen or meet qualified non-citizen criteria. Enrollment capacity. Waiver programs often have limited slots, and many involve wait lists. Priority may be given to those at highest risk of institutionalization. These programs are vital for establishing culturally responsive community-based care. Would you like to explore how to help families navigate eligibility or co-design outreach materials that demystify the application process? I can also help tailor resources for specific populations, like older adults with cognitive impairment or multilingual households. Okay, fine. The next section, guys, is financial thresholds for Medicaid waiver programs. Vary significantly across states, reflecting differences in costs of living, policy, and priorities. And program design. Here's a breakdown of how these thresholds differ and what that means for individuals seeking long-term care support. How financial thresholds vary by state. Income limits. Standard Medicaid typically set at or near the federal poverty level, but waiver programs often allow higher limits. Waiver flexibility. Some states permit incomes up to 300% of the supplemental Security income, SSI, federal benefit rate. About $2,829 a month in 2025. Example states like California and New York may offer higher thresholds due to higher living costs. Other states may cap income lower, requiring spending down strategies or special trusts. Asset limit. Most states set asset limits around $2,000 for individuals and $3,000 for couples. Okay, examples. Primary residence, one vehicle, and personal belongings are usually excluded. Variations. Some states allow more generous exemptions or use Miller trusts. Qualified income trusts to help applicants qualify. Spousal protections. States may apply spousal impoverishment rules, allowing the non-applicant spouse to retain a portion of income and assets. These rules vary widely in terms of minimum and maximum allowances. State-specific waiver. Each state administers its own set of waivers with tailored eligibility criteria. Some target seniors, others focus on individuals with developmental disabilities or mental health conditions. Wait lists and enrollment caps also differ by state. For example, Pennsylvania's waiver programs may allow higher income thresholds for home-based care than standard Medicaid, while Florida might require stricter financial limits but offer broader services coverage. Would you like help mapping out financial thresholds and waiver options for specific state or community? I can also design comprehensive guide to or decision tree to support families navigating eligibility. Okay, financial thresholds for Medicaid waiver programs have profound impact on individuals seeking long-term care, often determining whether they can access care or not. Essential services or face significant out-of-pocket costs. Here's how these thresholds shape outcomes. Impact of financial thresholds on access to care. Eligibility barriers. Individuals slightly above income assets limits may be disqualified even if they cannot afford private care. This creates a coverage gap for middle income seniors who are too rich or too rich for Medicaid but too poor to self-fund care. Forced spend downs. Many applicants must reduce their assets to qualify, even often by spending savings on care or using legal tools like Miller trusts. This can erode financial security and limit options for future needs or family support. Geographic inquiries. States like California and New York offer higher income thresholds due to cost of living, while others like Florida may impose stricter limits. This leads to unequal access across states, with some residents benefiting from more generous waivers and others facing tighter restrictions. Delay or denied care. Wait lists and enrollment caps mean that even eligible individuals may not receive timely services. Those at highest risk of institutionalization may be prioritized, leaving others without support. Spousal and family stress. Spousal impoverishment rules vary, affecting how much income and assets a non-applicant spouse can retain. Families may face difficult decisions about caregiving, housing, and financial trade-offs. Okay, guys, that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks. Have a good evening. Peace.